This is part 2, care of the client with hematologic disorders. The hematologic system consists of the blood and the sites where blood is produced, such as bone marrow and the reticuloendothelial system. What conditions belong here? You've got your leukemias, which is a neoplastic proliferation of one particular cell type. The defect will originate in the hematopoietic stem cell, the myeloid or the lymphoid stem cell. Common features is an unregulated proliferation of white blood cells in the bone marrow. The cause is not fully known. Some evidence is there that it's either genetic or viral influence. They are classified according to the stem cell line: lymphoid, myeloid, or acute or chronic. And as you can see, we have acute myeloid leukemia, chronic myeloid leukemia, acute lymphocytic leukemia, and chronic lymphocytic leukemia. Your malignant lymphomas are neoplasms of lymphoid tissue, usually derived from B lymphocytes. Tumors usually start in the lymph nodes, but can involve lymphoid tissue in the spleen, GI tract, liver, or bone marrow. They're classified into Hodgkin's and non-Hodgkin's lymphomas. Multiple myeloma is a malignancy of the most mature form of your B lymphocytes, the plasma cell. It's not classified as a lymphoma. Plasma cells secrete immunoglobulin, which is a protein necessary for antibody production to fight the infection. What's a stem cell differentiation? In the bone marrow, there are stem cells which have the ability to self-replicate. When stimulated, they differentiate into either myeloid or lymphoid cells. The stem cells are committed to produce specific types of blood cells. Myeloid cells can produce erythrocytes, leukocytes, and platelets. So a problem derived from the myeloid cell can affect all three types of cells. The lymphoid cells can produce either T or B lymphocytes in your plasma cell. And just as a reminder, in case you can't remember, your normal white blood cell count, your leukocytes, protect the body from invasion of bacteria and other foreign bodies. They divide into the following categories. Neutrophils, 50 to 70%. Their major function is phagocytosis. Your bands are your immature neutrophils. Your segs are your mature neutrophils. Your lymphocytes are about 20 to 40%. Monocytes are 2 to 6%. And so neutrophils are the first thing to go in the inflammatory response. Monocytes are the second thing to go, and eosinophils finish the inflammatory response. They also deal with hypersensitivity reactions. So do your basophils with hypersensitivity reactions. Your erythrocyte, your normal leukocyte is 5 to 10,000. Your normal erythrocyte is 4.5 to 5.5 per millimeter cubed, I think. Your thrombocytes are your platelets, and the normal for that is 140 to 400,000, and they control bleeding. So you need to review your pathophysiology for the different types of leukemias. Acute myeloid leukemia is a defect in your stem cell that differentiates into your myeloid cell. All ages are affected, but it peaks at age 60. It's the most common non-lymphocytic leukemia. The prognosis is variable. You may have a potentially curable disease, but older patients tend to have a worse prognosis. Clinical manifestations are fever, infection, and neutropenia, weakness and fatigue from anemia, and bleeding tendencies from the thrombocytopenia. Complications include bleeding and infection. It's treated with chemotherapy. Bone marrow transplant is an option, and they do tend to have a 5-year survival rate of about 40%. Chronic myeloid leukemia is from a mutation in the stem cell that differentiates into the myeloid cell. The normal myeloid cell will continue to be produced, but there's a preference for the immature forms as well. There is uncontrolled proliferation of the cells. It's uncommon in people under the age of 20, but the mean age is around 40 to 50. The disease can remain in the chronic form for a while, but once it becomes acute, the overall survival rate rarely exceeds several months. So the 5-year survival rate is around 30%. Acute lymphocytic leukemia is the uncontrollable proliferation of immature lymphoblasts from the lymphoid stem cell. This is most common in children and has a 5-year survival rate of about 80%. And then you'll learn about care when you get to peds, and you remember patho from last semester. Chronic lymphocytic leukemia is a malignant clone of your B lymphocytes. These are your mature cells. It's the most common malignancy of older adults over the age of 60. The average survival is around 14 years. Hodgkin's disease is a fairly rare malignancy. It is a neoplasm of your lymphoid tissue that peaks in your early 20s and then again after age 50. It can involve lymph tissue in the nodes, spleen, GI tract, liver, and bone marrow. It has a formation of the Reed-Sternberg cells that we talked about. It has the first symptom is usually a palpable node, lymph node, that doesn't move and gets enlarged. Non-Hodgkin's lymphoma originates from the neoplastic growth of your lymphoid tissue. It mostly involves your malignant B cells. This has a fairly long-term survival. With both of these, the older you are when this develops, the better the prognosis. Multiple myeloma is a malignant disease of the most mature form of the B lymphocyte, the plasma cell. This causes severe bone pain, and it is metastatic. Survival here is 3 to 5 years. May require various amputations. So with these disorders, the blood test that you would expect to see would be a CBC and a peripheral blood smear. You may need a bone marrow aspiration, and as the nurse you need to know what you're going to do, which is going to provide some pain relief ahead of time, and make sure your patient knows it's not going to be that terribly uncomfortable, but it is going to be uncomfortable, and you need to read about it in your textbook. The lymph node biopsy will be done and the CT scan. Your nursing assessments, you're going to assess for weakness and fatigue. Those are the most common symptoms. You're going to look for subtle signs of infection in their skin, mucous membranes, respiratory tract, GU and GI tract, their neurological system. You want to closely assess their lab results and assess for any bleeding that they might have. Nutrition is really, really important because they'll be in a hypermetabolic state from chemotherapy and the disease process. They'll also have associated anorexia, pain, and nausea. So assessment and management of nutrition is very important. Mouth care before meals and at bedtime. You want to use analgesics before eating. Use that magic mouthwash that has an anesthetic agent that will make it feel better. Give them an antiemetic if they're nauseated. Give them small, frequent feedings on nutritional supplements. Make sure you do a daily weight to keep a close assessment on that. You need to closely assess and manage the pain. They'll have recurrent fevers that are common with the leukemias. That's uncomfortable. Stomatitis causes discomfort. This is a major problem with multiple myeloma, the pain. We talked about that. They'll have activity restrictions. They need good body mechanics, and they need routinely administered pain medication. You need to manage their fatigue. Maintain a balance between activity and rest. Make sure that they sit up when they're awake, because that's better. Get them out of bed, because you lose 3% of your muscle mass, and you start to lose bone mass every time you stay in bed for 24 hours or longer. Physical therapy may be useful. Maintaining fluid and electrolyte balance is important because of the febrile episodes, the bleeding, the nausea, the vomiting, and the diarrhea that occurs from the chemotherapy. Fluid and electrolyte imbalance is a very strong probability. So strict INO is important. Daily weight is even more important because patients who are allowed up can always drink from the fountain or go to the bathroom down the hall. You want to assess closely for signs of dehydration or signs of fluid volume overload. And what lab tests would you look at if you had somebody who you were looking at for hydration or fluid volume overload? That's right, you check your hemoglobin and you would check your BUN and creatinine as the two major indicators. You want to prevent bleeding, so you're going to maintain bleeding precautions. Don't give them any aspirin. No IM injections. No indwelling catheters, no rectal temperatures or meds, because the rectal area is very vascular. That's one reason it's used for homosexuality is because it is so very vascular. Avoid straining. And by the way, if they were homosexual, they would not be able to participate in sexual activity during this time. They should avoid straining. Use small gauge IV catheters. Use a very soft toothbrush. Make sure you lubricate the skin and the lips with something that is non-drying. Do gentle suctioning only if it's needed, and maintain safety precautions. Good hand washing is a must. They can only have healthy people as caregivers. They need to be in a private room to protect them from other people. No fresh fruit or flowers because of the bacteria that may, or viruses that may be attached to them. You want to keep invasive lines to a minimum. Prevent dryness of the skin and the lips. Good body hygiene. Their vital signs with their temperature every 4 hours. Assess for subtle signs that they may have a problem before they actually get septic. Blood products will be administered, either whole blood or packed cells. They may have transfusion of platelets or fresh frozen plasma, and you need to assess closely and for complications. Keep a close eye on this for complications. Anxiety and grief are given because they need to understand their illness and need to understand the stage of grief they're in so that you can help them the most. They need to assess their spiritual well-being, offer emotional support, and family support. And finally, the Victory Center has support services available for the family and for the patient. There are support groups that are out there: the National Lymphoma Society, the Cancer Society, the local American Cancer Society, or hospice are all possible places that could be, you could find some support for these patients. And this completes the hematologic section.